What is the role of HIV and body count? Higher the number of partners, particularly unprotected, which can lead to HIV is nothing but, so what it will do? It will automatically decrease blood transfusion, that is any IV drug users or any needle users, or there also you can get, whether you are using condoms and whether the other sexual partner where condoms used. Can use of condoms can prevent HIV transmission 100%? What if you have had already unprotected sex? Hey there, welcome to my channel. Today we are diving into a topic which raises your eyebrows and which can lead to debates, and also in future it can affect your public health. That is nothing but HIV and body count. Does the number of sexual partners really linked with HIV? Should you worry about it? Or is it just a number that society overhypes? So let's go beyond the stigma today and let's discuss this topic, which can be a life-saving for so many. I'm not here to judge anyone. It's just a straight talk. I'm Dr. V Suresh, specialized in preventive health and public health. And also I am the chairman of Iconic Dental Hospital. So today I will tell you health tips along with dental tips. So what do we mean by body count? So nowadays you can see in social media regarding this topic that is called as body count. So what is body count? Body count is nothing but having multiple sexual partners. For some it can be a trust, for some they can be a reputation or a curiosity to do this body count and all. But for our healthcare specialist, it is a risk exposure. That means for how many people you are getting exposed. Higher the number of partners, particularly if unprotected, which can lead to exposure to HIV or other sexually transmitted diseases. Now what is HIV? HIV is nothing but human immunodeficiency virus. So what it will do? It will automatically decrease your immune system by decreasing the CD4 cells counts. So what happens if you are not treated early? It can lead to the severe complication that is called as AIDS, which is a severely immunodeficiency disease. Here is the good news. Suppose if at all if you are affected with HIV, if you are getting treated in the early stage, you can lead your life as long as you want, until unless if you take medication properly. So mainly how HIV is getting transmitted. So mainly the sexual route is one of the main important cause. Secondly, through blood transfusion, and thirdly through mother to child transmission. That is, third aspect is nothing but mother to child. That is nothing but if the mother is having HIV, definitely it will be transmitted to the child. Now coming into the second topic, that is called as blood transfusion. So blood transfusion, that is any IV drug users or any needle users, or there also you can get the HIV. Next through sexually route, it can be transmitted through semen or vaginal fluids or rectal fluids. And one more thing is HIV is not getting transmitted through just kissing, hugging or sharing of any foods. So as a healthcare specialist, so we will now discuss regarding what is the role of HIV and body count. So statistically if you see, there is always a significance. That means more number of sexual partners means always there is a chance of getting HIV. Until unless you should check for some criteria and whether the other sexual partner where condoms used or other partner is already affected with HIV, or the other partner is a new one who you don't know previously, or does alcohol or drugs influence to have that act. So these are all the conditions you should check upon before getting the doctor. Alcohol or drugs affected their decision making ability. So let's see regarding the studies. Studies shows that having more number of partners leads to a greater chance of getting HIV. But I am saying that not only more number of partners, even though a person is exposed to one partner who is already having HIV, then also the particular person can be affected with HIV. So let's see what are the common myths regarding this particular HIV virus infection. So can you able to identify the patient or a person who is having HIV? No. He can be normal for so many years until unless he gets the symptoms. So you cannot identify the HIV patient in public. Next, can use of condoms can prevent HIV transmission 100%? No, it cannot prevent 100%, but to the maximum it can prevent getting infected with HIV virus. So many things that HIV is not a manageable condition or a treatable condition, but it is a manageable chronic condition if detected early. So always test early if you are having any doubt regarding HIV transmission. So how to protect yourself? Usage of condoms whenever you are doing such act. If you are having multiple partners, always get it tested for every 3 to 6 months and take advice from the doctor to take a pill that is called as pre-exposure prophylaxis before any act, and always avoid usage of razors or needles with others. Avoid risky sex under alcohol or drug influence. What if you have had already unprotected sex with some unknown partners, then definitely you should get a HIV test immediately, that too in less than 72 hours. As early you get tested and get your prophylaxis treatment, that is called as post-exposure prophylaxis, it can be cured completely. And you can have a test after 3 months also for a confirmatory diagnosis, but immediately less than 72 hours, try to get your doctor and start your treatment. So finally I want to conclude that whether the body count is directly related to the HIV, no, it's not about the body number, but it's about the risk behavior. So practice safe sex, get tested and stay informed. Respect your body and others. So if you like this video, just like, subscribe and share this video with someone who is really in need.